Hello, and welcome to the Managing Post-COVID Fatigue webinar series. This is Psychology Session 1, Introducing Core Concepts. My name is Hope Clayton, and I am a health psychologist working in the BLMK Post-COVID Fatigue Service.
And hi, I'm Holly. I'm an assistant psychologist in the post-COVID fatigue service. So in today's session, we're going to explain a bit about why psychology is part of this programme. We're also going to introduce some of the core concepts that will underpin this course of the webinar series, and we'll aim to build on some of these core concepts each week. We're also going to work out an intersession task to have a go at between this session and your next psychology session.
So we just thought we'd take a little look about what you may expect from us and from the webinar series going forwards. So we thought of a few things that you may well expect and that people have told us they are looking forward to or hoping for. First of all, we hope to provide evidence-based tools to support you to manage post-COVID fatigue symptoms and build your own toolbox. We also want to offer the perspectives of multiple disciplines to ensure the most comprehensive support is provided. And that's why in this webinar series, you're going to hear from psychologists, occupational therapists, and physiotherapists. It's important to note that what we're providing is a set of ideas and approaches and strategies. There's not going to be one size that fits all, and it may be about trialing different things or thinking about what works for you best as an individual. And it's also worth noting that people often tell us they have many different kind of feelings and emotions and hopes and fears before they start this program. It may be that you're perhaps feeling quite hopeful or excited, or it may be that you're apprehensive and nervous. Whatever you're feeling, all is welcome here.
So we're just going to think of some expectations of you now that we have. So we expect that you take the webinars at your own pace. Please do them when feels right for you. And we'll also be emailing you out a workbook for each of these webinar sessions. So you'll have one for psychology, one for the physiotherapy, and one for the occupational therapy sessions. Please feel free throughout the webinars to pause and take any breaks as and when you need. And also feel free to take any notes if you find that helpful. We do ask that when you're emailed the webinars, you can complete them when suits you, just so you're progressing along the programme.
So we thought firstly we might start with a kind of slide and a bit of a discussion about why you're here listening to two psychologists today, given that you've got very real physical symptoms. Well, if we can look at this model here, this is called the biopsychosocial model. And don't worry too much about the big name there. But traditionally, our healthcare system has been focused on a biomedical model, and often how we think of health, well-being, and illness is quite a dualistic approach. So we tend to think of the mind and body as being separate. And in this model, this idea of a biomedical model, people become unwell. Doctors or nurses or people with specialist knowledge cure and treat disease by the use of biomedical methods, such as an operation, procedure, or medication. And in this biomedical model, people are treated as just a body that is ill or diseased by people with specialist knowledge, and they treat the body externally from any other psychological or social factors. But we know, however, that there are many determinants of health, and that illness and health are the result of an interaction between biological, psychological, and social factors. This model also highlights that the mind and body aren't separate and are constantly interacting. We know, for example, that emotions are a series of chemical reactions within our brain that communicate with various bodily systems to produce certain physical symptoms. How we think and feel also influences what we do and how we take care of ourselves. If we're stressed, for example, we're maybe less likely to do things that might support our well-being, like going to the doctors or eating a healthy diet. And it works the other way too. If we aren't able to do the things that matter to us, we may feel fed up or frustrated or depressed. So the mind is influencing our body, or the brain is influencing our body, and the body is influencing the brain. Understanding this brain-body link means that we can use it to our advantage, making positive and meaningful changes to our lives and better managing our fatigue. So how do we pull apart and understand something as complex as the interactive nature of our body and brain? Well, here we have the three systems model, and this is a model taken from a therapy called compassion focused therapy. To think a little bit further about how our mind may be influencing our health, let's have a look at this model and zoom in on each area. At the bottom, we have our threat system in red, and the function of our threat system really is to keep us safe. It's to manage threats. It's for our protection. And it tends to be act on a kind of safer than sorry principle. It tends to be more sensitive than the others just because it's a way of keeping us alive and safe. It's better to see a bus coming towards us and run away that isn't there than to have missed it and get run over. And the hormones that are associated with this system are things like cortisol, adrenaline, noradrenaline, and this is really where our kind of more tricky emotions come in, the ones that we perceive to be a bit more difficult, a bit more uncomfortable or unpleasant. So that's things like anxiety, anger, disgust, sadness, and shame. We're then going to move on to our drive system in blue. Our drive system is all about achieving goals, getting things done, consuming, accomplishing tasks. And the related hormone there is dopamine. That's our feel-good hormone. When we're in our drive system, we tend to feel motivated, alive, or excited, driven, vital. Finally, we have our soothing system in green. And the function of our soothing system is to slow down. It's to connect with others, to rest and digest our food, give our body rest, and to care for others and feel soothed, content, safe. And the hormone that's released there is oxytocin.
So within this session, we'll be focusing on this threat system as Hope's just described. So we're going to have a look at how the threat system influences our fatigue and how we can manage it to alter the impact it has on our fatigue.
So now we're going to have a look at how our threat response is linked to fatigue, as Holly just mentioned. We're going to have a look at how our psychology is linked to our physiology. And I think it's important to note here that we're not saying that because you're stressed or because you're in your threat system or having a difficult time emotionally, that this is the sole cause of your fatigue. That's not what we're trying to infer at all. This just means that it's one contributing factor. And from our work with people who have post-COVID fatigue, we tend to see people who are in their threat system quite a lot of the time due to perhaps their illness, also other stresses in their life, and the impact that the pandemic has had on them as a whole. But bear in mind that this is not a one-size-fits-all program, as I said before, and it may be that you perhaps don't identify with being in your threat system a lot. It may be here that you'd like to pause the webinar and take however long you would like to look over this table, as there's quite a lot of information to take in. So just picking out a couple of responses here in the table. I won't go through everything, But sometimes we see that when we're in our threat response, our brain perceives a threat and it releases a lot of adrenaline. And sometimes that can be to just kind of help us push on through to get the task done. But we find that when that task has been done, we often have an energy crash because the adrenaline has dropped down. And often we can find through various stresses and through pushing ourselves and then crashing, we kind of have a peaks and troughs, a boom or bust approach to our kind of activity cycle and the way that our energy levels are playing out. So we know that prolonged stress has the potential to disrupt normal functioning of bodily systems. So this might be our sleep-wake cycle, our digestive processes, or even our pain sensitivity. And our bodies can become highly sensitive to normal day-to-day events, a bit like a sensitive car alarm that's going off when the wind blows as opposed to a natural break-in. And the body can respond and start to respond when we're under a lot of stress, as though everything it encounters in a threat. So this might be becoming sensitive to activity, light, noise, food, and stress.
So with this clear link between our threat system and the exacerbation of our post-COVID fatigue symptoms, it's really important that we learn to observe and rebalance these three systems when they have become quite hypersensitive, as Hope has described. There are various psychological tools that we can use to minimise the impact that this physiological system is having on our fatigue experience. So this is us using that brain-body link that we previously discussed today. All of this should be in your workbook as well, but as Hope said, please feel free to take a moment to pause this slide.
So we've come to the end of the information today, and we felt that we might like to give you a bit of an intercession task for you to be doing between now and watching the next webinar. And really, before we can start to enact change, we need to begin to reflect and just notice what's going on and when we're in each of our different systems. So what we'd like you to do is have a think about throughout your daily life and your daily routine, when are you in each of your systems? So it might be, for example, that you're having a bubble bath and you're feeling kind of safe and soothed and relaxed, and you think, I'm in my soothing system right now. Or it might be that you're due to have a call with your boss who's asking when you're coming back to work, and that conversation is about to start in a couple of minutes, and you're feeling really on edge, you're feeling very anxious, and you might think, I'm in my threat system right now. So it's we just ask that you start to notice this. In your workbook, there should be some space, some room for you to record your reflections on this. Do that if that suits you. It might be that you want to discuss it with someone else, a family or member or friend. It might be that you just want to take some time to think about and reflect on it on your own. And we do really value feedback. So our details, our telephone and our email are on this page, but also there's a QR code there. So if you want to get your phone out, if that's your bag, and scan the code, then we really do act on feedback. We have a monthly meeting where we discuss all the feedback we've got, and we make changes accordingly, depending on what people say about the service they've received. Thank you very much. We really value you coming along today, and we look forward to working with you more on this programme, this webinar series.